Hair loss is such a common concern, both for men and women. So what are the best and most effective treatments for hair loss in 2025? So the first thing I would say is that there are a lot of prescription medication options available, but there is not a one-size-fits-all approach. So you could go and buy Regain over the counter in a pharmacy, for example, but is that actually going to work for you? Or are you going to be a good candidate for being on finasteride? Some people are, some people aren't. So we guide very much using something called a trichor test, which is a cheek swab genetic DNA test that we send off to a laboratory, and it guides us on maybe why you're losing hair and what can be done about it. And that could include the things I've just mentioned, things like finasteride or dutasteride, often used as a topical formulation that you put on the scalp rather than a tablet. It can include prostaglandins, and it can include, even for particularly women, estrogen. We can do an awful lot to help on a topical level, but maybe in a more bespoke way. I think it's also important to understand that your medical health can play into your hair health. So understanding if you have nutritional deficiencies, hormone deficiencies, or if you're taking any medication otherwise that could impact your hair loss is all really important to consider before you embark on a treatment program. So a consultation with, again, a medical professional or a trichologist, crucial. When it comes to what can be done treatment-wise, there are a few things that tend to work really well, and usually we think about regeneration because we can hopefully kind of wake up follicles that are maybe asleep, but if they're follicles that are dead, we're not going to be able to bring those back to life. So regenerating the ones that we can be done through maybe using exosomes, and we use a product called Derive, which is amazing and we've had great results with. You can inject polynucleotides into the scalp with some beautiful results. You could look at microneedling with those exosomes. You could look at platelet-rich plasma therapy, which has some great results and great data. Or you could even consider using a sort of an off-the-shelf stem cell or growth factor product, provided you're looking at things that are not of a human origin from a safety standpoint in the UK. So these are all options, and for many people will give a good result. But there are some for whom, if more of those follicles are dead and the hairlines may be receded more, that a transplant is the best choice. A hair transplant done by an expert will give you back much more pleasing hairline. It can restore and improve hair density, and it does come with a little bit of risk and downtime, but this is very well managed in experienced hands. So for those people who are good candidates, I would always recommend having a consultation for a transplant and then thinking about afterwards combining that with regenerative therapies to help to maintain your hair density for as long as you can afterwards.
If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.